Thanks for staying with us on Consider This. Melisa and Sharaad here with you this evening, and we're speaking to Datuk Dr. Zainal Ariffin Omar, President of the Malaysian Public Health Physicians Association. Now, Dr. Zainal, just before the break, you talked about wanting more transparency in the communication from the Health Ministry around the COVID-19 cases. I'm wondering whether there is a potential that would potentially backfire. If there are trade-offs for more transparency, could that lead to perhaps stigmatization of patients or of places? Could that impact businesses even more? What do you think?
Yeah, actually, this is a pro and contrast. I think the authorities, the Ministry of Health and the government, they're worried about, number one, is they call personal confidentiality, or for example, under Medical Act 1971, you cannot release the name of the patient, the place, or this thing. And we worried, they worried about stigmatization. People be isolated, be boycotting, and people not going to the places, all this thing. But in the current era of information technology, and people are very knowledgeable, so we have to balance between these, these two issues, with this community empowerment and community mobilization, because there's a two very strong approach how to control this outbreak. Number one is what we call social distancing. Number two is personal hygiene. Okay, imagine how you want to do a control, focused social distancing if you don't know where. For example, a place, if you know the masjid, or you know the church, or you know the market, been hot places. So the best thing is social distancing. Number one is you don't go to that place. Or number two, if you go to that place, you take proper precautions. So this is what we call community empowerment and community mobilization. And people in the community can help. Who are for example, people personal investigation or the family, so people can help. This is what happened in Singapore, in Korea. So they give the detail, even they know where's the house, the street, or so people will help. So we must empower the community. We must trust the community. They can do the action for the community, by the community. So I think the era that ministry have to really appreciate this approach. So we don't have to worry much about this confidentiality, stigmatization, or thing.
Okay, so that's where you land on the question of the trade-offs. You much prefer openness. I want to ask you this other thing, which is that at the start of the cycle of this virus, there was talk about a vaccine being created, right? So we have containment as a strategy, we have testing, but it's limited in Malaysia. What is in your experience? Is a vaccine likely as a solution to the problem of COVID?
So actually, technically, they will take time, 3, 6 months, or 1 year. I think in many technical journals mention, the earliest we can get the vaccine about around 6 months to 1 year. So it takes some time. So and the second thing, people also expect this what they call this community herd immunity. This when a lot of people get affected and then they got some form of immunity. This is what announced by the UK. UK said that the disease spread in the and they got the community. But this approach is not that totally right, because you expose people to a risk. But you have to wait between 6 to 1 year to get a vaccine, proper vaccine.
Okay, it's going to take a while.
Yeah, it's going to take a while. But I do want to ask you, since you brought up the herd immunity issue, is the cost. There is a cost to all these things. Testing in Malaysia, I know the government testing much less than private testing. But even the vaccines, if we have one, the cost to the public purse, if we wanted to have universal access to vaccines. Where do you, as a community health expert, where do you stand on this? Should we have a universal healthcare? I mean, vaccinations?
Because I think, number one is the cost, vaccine, definitely a cost. So this is what they call we have to prioritize. So they will give a vaccine to vulnerable group, high-risk group, and maybe the frontline workers, same like pneumococcal vaccine, because the cost is one. So I think no country afford to
can do universal
vaccine.
Well, okay, so Doctor, you described yourself as a public health activist just now. In the last couple minutes that we have left, can you tell our audience now, a lot of people are worried and there is a significant level of alarm and fear. How do we balance that out with what is actually happening with the facts of COVID-19?
Okay, number one, you have to trust the government in this region. Not because I'm from Ministry before, but we know their competency, their skill, and their knowledge to tackle this outbreak or this epidemic. Number two is, follow the advice. Although it's a general, social distancing, this is personal hygiene, but we have to follow that. And the other one is try to mobilize the community. Because go on the, as a public health activity, we go into the communities. We can sense what's the problem, and then we can try to minimize their worry. So it's not easy to say, hey, please come, and then don't worry. But in terms of when it's happened in the community or in neighborhood, so then we start to worry, and we need a real what you call info. And then the government said, don't listen to fake news. Don't listen to, what you call,
forward messages.
But the problem, what is the real news?
Right.
What is the
information to fill that?
If the government give the information, so we follow the information, but the information is not there. So people start doing this fake thing.
Okay, should they buy toilet paper in the hundreds?
So, no, I don't think so.
Don't hoard toilet paper,
Don't hoard
folks.
toilet paper.
That's all the time we have for you on this episode of Consider This. Thank you so much, Datuk, for being on the show with us today. I'm Melisa Idris, with me, Sharaad, Kuttan, signing off for tonight. Thank you for watching. Have a good evening.